All right, you're live.
Hi everyone, it's Danielle with Dr. Emer's office. So it's staff injectables night and we have all our Galderma products ready to use. So I'm going to start with our patient here. We're going to work on her cheeks just a little bit. She has a nice amount of volume, but I want to just give her a little bit more definition. So we're going to start just to fill in right over here and build up laterally, just a touch to each side, because then the areas that I really want to target are her under eyes because they do lack volume. A little bit to her folds and a little bit to her chin as well as her lips. So we're gonna do a little bit in each area, not work on building volume, but just adding a little bit to shape and definition. So I'll start right over here. Go ahead and smile for me. Good, and relax. Little poke.
Now remember, when people have rounder faces, you really want to do things to lift their face laterally and project their face forward so they look more slim. And our patient here today, she has a little bit more of a rounder face. She is more fuller in the mid face. So it's very important to do a product that has a nice substantial amount of lifting capacity to be able to hold that tissue up and give it the shadowing effect when there's a side light, which we have going on right here. So Danielle, our PA, is right now injecting deep onto the bone of our lateral cheek area to give that highlighted definition that we normally would want to see with some filler injections. Now most fillers are going to be too watery to hold up this area in somebody that has a little more heaviness to the tissue. And in this case though, however, we're using Restylane Lift, which has a little bit more of the capacity to hold everything up. And so she's going to see that immediate shadowing effect on her cheekbones.
Okay, so we did just a little bit here.
And you can see what we're talking about. If we show right here, go ahead and take that off for 1 second. Right there, that little shadowing, right here, all the makeup artists know about it. Turn your head a little this way. Right there, show that little lower, right there, this area, that's where you get that lifting look. She's gonna notice it mostly when she puts makeup on.
Okay, so the next thing that I want to jump over to were her under eyes. She has more hollow under eyes, and the true way to correct this would be to kind of remove any excess fat here and eventually relocate the fat pad. What I want to do is bring up this trough a little bit, so I'm going to be combining deep injections with more superficial. So I'm going to start right here. They're going to be deep on bone, very, very small little aliquot injections. And just follow my way through the trough. And it'll sound kind of funny, but it's a great area to lift up volume. With needle, I like working deep because it's very precise, but we did talk a little bit about the risk of bruising here. There are a few areas that have a higher bruising rate, and under eyes are one of them because of the high vascular network there. Very, very superficial. How are you feeling? Good. I'll feel it. Good.
So take a look, let me slide forward a second, I just want people to see. So you can take a look here at already how much some lifting there is to this trough area. The thing is, when someone has so much of a lower cheek and a wide distance between their eyelid and their cheek, it's actually best to surgically remove those fat pads. Doesn't matter the age, it's the genetics, there's nothing you can do. So if some patients want improvement, we can use fillers like we're doing here to give them some improvement in the meantime, but you have a risk of developing some puffiness there. So we'll watch her slowly and we'll build over time. Okay, go on, lean back.
Chin down a tiny little bit.
Why aren't you using a cannula?
Because we're demonstrating a different technique. And in her case, we really want to be at 2 levels, 2 different layers. Here doing the deep layer first, then we're going to work on the superficial layer, try and give them a little space so they can video. But there's a higher risk of a little bit of bruising but we're going to be able to be a little more precise with somebody like her that has much more volume loss in this area.
And you can really see I'm starting out laterally, but you can see where the volume has lifted and at what point I stopped where I was working. So I do love working deep here. The combination of deep and superficial, I think, yields a really nice result. Again, like Dr. Emer was saying, you do run a risk of puffiness. So when it comes to this area, I always tell patients that's something that we'll work on over time. It's better to start with a little bit and let it settle nicely and then add as needed.
So she's using Restylane Define, which has a nice lifting capacity. It's soft in this area for people that move or smile a lot or exercise. Also, she's raising her eyelid. You can see where the puffiness comes, so it's easier to kind of mesh that filler directly into that area. I think the go-to filler for a long time was just basic Restylane for the under eye area. And probably a lot of people still continue to do that, but have shifted over to more of these mobile fillers because of the softer look. Now, one key to doing the under eye is to never forget this lateral crease. And initially right now, she's working more in the mid-trough, but it'll be good to move more laterally and address the crease because people age in that area too. And they get some hollowing. And if you fix the middle and you don't fix the lateral part, then it looks like something was done.
I'm a big fan of changing out my needles over here. Less likely to bruise.
Yeah, that's
Okay.
That lighting is good.
There we go.
Smiling patient is the happy one.
It's always a good sign.
What were you looking to achieve with your under eye? Tell everybody.
I was hoping to slightly get rid of the hollowness because I did understand that it's going to take time and the best option would be the fat removal.
Surgically.
Surgically, yes. But yeah, just hoping to get rid of the hollowness a little bit. Don't look so tired.
Yeah, and let everybody know you're mommy or not.
Mommy.
So you're always tired.
I'm always tired.
Okay. So because she's a mommy, she's always tired. So what do you gotta do to spoil a mommy? You treat their under eyes.
Let's jump a little bit more.
Yeah.
Good. I'll get back.
So now we're gonna go to the second layer in this area, but here we're gonna use a cannula. Tell everybody what a cannula is.
All right. So a cannula is a blunt-tipped, basically instrument. It's an extension of your syringe. Instead of a needle, you have varying lengths. And so the benefit is that you can access a variety of angles. You can see here that I can target all the way into the medial aspect of her under eye and the lateral aspect with one access point. And the benefit as well to having cannula is that it is blunt, so you have less likely to cause any bruising. It's less traumatic. But because of the manipulation under the tissue, you do have a little bit of swelling that comes with it. So that'll go
Rosa,
down.
Maureen says you're beautiful.
You are beautiful. We miss you.
Great. We miss you.
So somebody's asking, are you using Voluma?
Not Voluma.
What are you using?
So we were using Define, which is a comparable filler in terms of lifting capacity and longevity. It is going to last quite some time where it's injected. We are now using Refine. And this, like Dr. Emer was saying, is something that's great for areas that require movement because it is a soft filler and it has great cohesivity. So it will move with you. It's not going to just stand out and be puffy when you smile.
Where do you like Refine?
I use Refine all over. I use Refine and Define kind of all over. So the thing I like the most with Refine probably would be under eyes, lips, troughs, anything perioral where we want it to be a little bit softer. Refine has definitely become one of my go-tos. Is this hurting you?
No. I don't feel it.
And I don't expect you to. Cannulas are very comfortable. Under eye filler is surprisingly comfortable. They numb very well. They're a very gentle area, and they are good in terms of the filler lasting quite some time.
For dark circles and under eye area, what else can you do if you don't want to do filler?
So for dark under eyes, it's a number of different things. It could be a lack of volume, and it could just be pigmentation or vascularity. So lasers, chemical peels, good skincare. There are a few options. Go ahead and open your eyes for a second. Look straight ahead.
There's a cool peel that we like to do for the under eye that you can do weekly for a few weeks to kind of decrease the pigmentation. There's a stronger peel that you can do called Cosmetic or Lighten to the under eye. And even just microneedling alone, along with the filler, gives a really nice outcome in terms of pigmentation. If you have lighter skin tone, sometimes you're seeing blood vessels underneath, and the blood vessels need to be treated or camouflaged with filler. So I don't know why someone wouldn't want to do their under eyes with filler. They just need to come here and be convinced.
Does filler stretch out the skin?
No.
No. It's a hard no. You're doing great. So I'm going to touch up this side a little bit. Go ahead and grab that. And then we'll move our way down. I always like to start with the upper portion of the face, see how well it lifts and how it changes the volume or the appearance of the lower aspect.
What's your opinion on Sculptra?
Sculptra is great. Dr. Emer, I love Sculptra. Sculptra is a good long-term volume option. So it's great to maintain your volume or build volume in areas where you're lacking naturally. And Sculptra and filler complement each other very well. One is immediate, one is a long-term result. You have to be patient with Sculptra and wait for it to take its effect over a few months. But as maintenance for someone who cares about maintaining their youthful shape or appearance over time, then Sculptra is definitely something to opt for.
How often do you recommend repeat filler appointments to maintain results?
Really depends on the person and the area. Some areas maintain their results a little bit longer than others. So it depends on how your body maintains the filler. Okay, I'm gonna let that sit for a little bit. Dr. Emer, how do you feel about under eyes? Chime in here?
The treatment you just did, or
Yeah.
what?
You want me to
I would add a
adjust?
little bit more laterally over on
Okay.
both sides. Look up with your eye, but see how the fat pads are still kind of bulging out. We already know that there's going to be improvement, but help a little bit. But over this lateral corner, there's two ways to do it. You could use the same filler you have. We can come more laterally and use the cannula across that direction, or you could stay where we are.
And we just changed to needle.
That's okay. I could have done the cannula either way. Now we're going to go directly into the bone right near the eye. I think that's a great idea to give a nice support there. Pretty good amount. And we're just going to do a little bit more, keep it going to build up that corner, because that's what I was saying, is that's the one area where when you're really being heavy on treating the middle portion, you want to make sure you're also treating lateral. And then I would go a little bit more laterally, right into the corner. Yeah, go a little more forward. There. And then one more step forward. Good.
What type of fillers do you recommend for deep concave stretch marks that can't be treated with lasers?
Well, they all can be treated with lasers. So in general, if they're deep concave stretch marks, they typically need a laser or some sort of surgery, and fillers aren't going to be the best choice, but you could put Sculptra there. You could do carboxytherapy, or you could start microneedling or micro-rolling at home. There's a lot of options we need to see you in a consult. Now, if you take a look at the technique, we're going all the way down to bone, going on the really lateral orbital rim. We're focusing on building out lateral part of the eye.
Someone said, "Great work, Danielle. Are you a nurse practitioner?"
I'm a physician assistant, but nurse practitioners and PAs are very similar.
And I think that's a good point for the eye. You can kind of fine tune some small areas here and over there.
Mm-hmm.
Maybe a little bit more right there.
Mm-hmm.
Her eyes are complex.
Her eyes are complex.
No lasers. Someone asked, are laser causing unwanted fat loss? No laser causes unwanted fat loss. That's a complete myth. Lasers do not go into the fat area unless they're targeted to the fat. They do not cause fat loss. And if fat loss were to occur, that means there was an actual tissue injury that was not supposed to happen.
What can you do to limit bruising and swelling?
We just wrote about this.
Yeah, why don't you tell them? What was that in? Glamour UK? What was that in?
Oh my gosh.
Glamour? I think it was in
We were
Glamour.
just featured in some article,
Yep.
in some magazine. We were talking about everything that you can do before, during, and after your injectables visit. And it starts with things like arnica and incorporating things like arnica, which are homeopathic bruising reduction agents. And then there's also things that you can avoid, like caffeine and alcohol, as well as aspirin, that contribute more to bruising. The other thing, pressure. If you do see a bruise, right away, holding a little bit of pressure is very good for it. Ice right away, red light therapy, all of those are helpful.
And don't do it before a wedding.
Don't do it before a big event.
Don't do it before headshots.
Resist the urge. Risk of bruising is always there.
Anticipate a bruise no matter what, and if you don't get one, be happy.
Okay, so we'll let those under eyes settle for a little bit. Don't want to overdo it, and we do know that's just going to be a little bit of softening and improving, but not a full correction of her tear troughs. So the next thing I want to do is move down to her chin. I'm just going to give her a tiny little bit of projection and then soften her folds a little bit. So completely anteriorly, we'll poke.
So her
Straight
chin
down to
is
the
already
line.
wide. Our goal is not to widen her anymore, just to project forward. So most of the line of the chin is going to be focused in line with the center part of the lip. So you want to see this little cute little pucker right here. We want to match that cute little pucker we're going to create over there. You see, it's coming forward like Jay Leno. What do you think? Just kidding.
Oh my God.
I didn't think you wanted the Jay Leno chin.
Oh my God. Quite the comparison.
No, I'm kidding. Oh my God. No.
Get out of here.
Just a small amount, and that enough was able to balance the lifting her cheek. And now you soften around the mouth.
Just a little bit of softening.
Do you use a vein finder? A vein finder?
No.
A vein finder?
I don't think that's necessary for filler injections unless someone's first starting out. We're experienced practitioners, been doing this for many years. I understand anatomy. I was a surgeon, a dermatologic surgeon, and but you can do it. But again, remember, you know you're gonna get bruise. Assume you get it, and if you don't get it, be happy.
Mm-hmm.
Risks are always there when you do fillers, but we take our chances, but we limit the risks by doing the best improvements we can, nice and slow. Injection, careful, understanding the anatomy. Here we're working to hydrate the tissue. We're doing little allopots in areas around the mouth to soften and blend the chin. I always tell people it's all about dimensional contouring. improving the entire area from the bottom up, from the bone to the soft tissue to the fine wrinkles. And that's how we get that look. That improved, much more improved look.
So poke.
Right there. We're just softening and projecting the marionette area, giving nice support to that area. Good, and then lastly, the best part,
Lips.
lippies. Get those lippies. And then what are you gonna do after?
Lucy and Co.
Use Lucy and Co. We love it. Why? Because it increases circulation. We think it actually decreases bruising after filler injection. What do you want? What type of lip do you want? What celebrity's lip?
That's celebrity.
Oh, no.
I don't know.
You have nice lips already.
You do have nice lips.
Now, the one caution to this type of lip is that if you do too much filling, it's going to look like she has a sausage on the top. Because she doesn't have, if you look at her lip, she doesn't have a midline part, and she has very little cupid bow definition. So if you overdo the filler, it's just going to look like one large strip. We don't want that. So what are you going to do?
Okay, so I'm gonna start by working right up top. I want to try to accentuate the cupid's bow. She's got it, but it's very small. So building up these peaks right in the center. And then what I want to do is work injecting kind of from overhead and lifting up with these, like the pillar technique.
Yeah, pillar.
So we're gonna work right in there, and then same thing on the bottom to give a little bit of medial projection. Pretty much everything will be focused in the center of the lips.
Let's see.
Personal poke.
Did you do a dental block?
No, we don't like dental blocks because we think that they can sometimes alter the shape of the lip and cause the lip injections to not look as good in the end. So we just have strong women here, amen. That's what it is. We just have the yoga, Pilates workout mothers, you know, that can just do it. They're willing. We also have great numbing cream.
Great numbing cream, strong patience. Switch sides.
We can do this in
We're
these.
gonna bleed.
You might.
A little bleeder.
If you need to sneeze, you can.
Some pressure.
Do you need to sneeze?
Some nice deep breaths.
Okay. Little poke into the philtrum. I know Dr. May, you like to do this also.
Depends on the person.
Depends on the
but yes.
person. Who's not a good candidate for philtrum filler?
It just depends on the look. Some people don't have great columns to begin with. You don't want to just create them if somebody doesn't have them.
Did you take aspirin, ibuprofen, caffeine, or?
No. Today, no.
Let me take a look. Dr. Emer, what do you think?
We'll get the bottom. And
Ah,
top
of
a little
course.
bit. Let's see. Bottom needs to be much more volumized. Her upper is way bigger than her lower, and that's not the proportion that we find as a standard of beauty. So we're going to volumize the lower by doing a pillar technique to evert the lower lip.
Can you repeat what product you're using?
Yeah, we're using Restylane Refine, and it's in the Galderma family of fillers.
Do you prefer a bigger bottom lip?
I prefer a ratio of 2/3 to 1/3. I want the lower lip to be bigger than the upper lip unless the person has a cultural reason not to have that. I would make the pillars a little bigger. So we're going to make the pillar a little more defined.
That's a good one.
And then we're going to finish up with the middle bottom.
Refine.
No, that's it for her. That's it for her. Just finish with that and then that's it.
Okay.
Unless that one's, let's see if that one, no, this is all.
Mhm.
It's good. Perfect. So now let's show her, let's clean her and show her, okay?
You okay?
Just like we didn't want this to leave.
Hold this here, let her wipe her
Hang
lips
on.
and everything.
Nope,
Let her massage, don't look, don't look.
Okay.
Let her massage a little bit, let her clean.
Do nothing. Opening off for a second.
So now we're gonna show the female facial sculpting for lifting in the cheek area, a little improvement in under eye, lip contouring, chin projection, softening around the mouth, marionette, nasolabial folds. So let's reveal final product.
Ready.
Dun dun dun.
Oh my gosh.
What do you think?
That looks awesome.
A little swollen, a little puffy.
What were you looking for?
The eyes look good. I like that they're a little swollen, but it looks nice. It looks so good.
Bring this down a little bit. There you go. What are you thinking? Do you feel refreshed?
I do. Feel refreshed.
What else?
Happy.
That's all we care about.
Yeah.
Looks good. You'll definitely have a little bit of a little swelling, a little bit of bruisiness. But other than that, everything will settle over the course of a few days.
All right.
Some ice on it.
Thanks, guys.